Hello, this is Tony Heller from RealClimateScience.com, setting the record straight about science. In this video, I'm going to discuss reopening the U.S. schools. It's been known for months that the vast majority of COVID-19 deaths were among people who are very elderly and/or suffered pre-existing conditions. This report out of Italy in Bloomberg News from 2 months ago said that 99% of those who died from the virus had other illnesses and that the average age of death was 80 years old. Italy provided a lot of valuable early data which made it possible to make rational scientific judgments. And the most recent data from the United States shows exactly the same thing. These are graphs I copied from the state of Massachusetts website this morning. The data from Massachusetts shows no deaths among school-age children, very few deaths among working-age people, and the average age of death was 82 years old. And just like in Italy, more than 98% of deaths in Massachusetts were associated with underlying health conditions. A large percentage of the deaths in Massachusetts were among people who would have died this year anyway. Like many other places in the world, the big problem in Massachusetts has been at nursing homes. The failure to protect nursing homes has been a disaster all over Europe and the United States. This is the current data from Pennsylvania. There have been almost no deaths under the age of 30, and there have been more deaths over the age of 95 than there have been under the age of 60. In Europe, the head of forensics at Hamburg says that nobody has died there without pre-existing conditions. The majority of deaths in Europe have been at elderly care homes. It is well established that COVID-19 is not a high risk for children, but not all viruses are like that. The COVID-19 virus is quite different from the Entero68 virus which struck in 2014. That virus mostly targeted children. In 2014, the CDC investigated 10 cases in Colorado of children with muscle weakness or paralysis. Contrast that with COVID-19, which has had very little impact on children anywhere in the world. Yet we closed down the schools for COVID-19 and didn't close them down for Enterovirus 68, which did have serious impact on children. As I'm going to show you in this video, a lot of the decisions made in the United States and in many other countries did not have a good scientific basis. The one country which did take a science-based approach was Sweden. Sweden recognized that the high-risk groups for COVID-19 were people who were quite elderly and/or were very sick. Sweden also recognized that the only way to get a country past a viral epidemic was to get most of the population immune to the virus. The goals of the Swedish approach were to 1. Isolate people at risk, and 2. Get the rest of the population exposed to the virus so that they would obtain immunity. The first goal of keeping high-risk groups away from the virus was not as successful as they would have liked. Just like in many other countries, senior care centers got infected. In Sweden's case, this was largely due to an immigrant population who worked in the senior care centers and didn't follow the rules. But the other half of the Swedish approach appears to have been very successful. They did not shut down their schools, restaurants, or bars, and they kept their restaurants at full capacity. Note that every table at this restaurant in Stockholm has customers. This is a fundamental difference between the Swedish approach and that which has been taken by other countries. Other Northern Hemisphere countries have tried to minimize exposure to the virus, whereas Sweden recognized that that was counterproductive and probably impossible. Sweden recognized that the sooner they get low-risk groups exposed to the virus and immune, the safer it will be for people in the high-risk groups. It's a win-win strategy which benefits everyone. It doesn't destroy the economy, and it doesn't destroy the morale or psyche of the residents. The Swedish approach is based around science and human rights, which are two key concepts which just about every other country have failed to heed. Sweden's chief epidemiologist Anders Tegnell says they are being successful. Tegnell says that the only thing which went wrong is that a lot of nursing homes got infected, which unfortunately happened in many other countries as well. Tegnell said Sweden's experience had shown that we can keep our schools open. That has not caused any major problems at all. It has not caused any problems that we can see. We can keep our society reasonably open without huge effects. This chart from CDC shows why the Swedish strategy of keeping schools open works. Only 0.1% of school-aged children who get infected end up in the hospital. This is considerably less than with the flu. One of the primary arguments used for shutting the schools down was that school children would then pass the disease on to adults. But according to the World Health Organization, there are no confirmed cases of young children passing the disease to adults. A few weeks ago, Denmark acknowledged the science and they reopened their schools, and Switzerland has done it now as well. In Switzerland, Daniel Koch, spokesperson for the Federal Office of Public Health, said, "It is very rare for children to transmit and get the virus. Children very rarely infect other children. The situation is stable and there is no contradiction that the schools are reopened. It is understandable and correct." So why aren't schools open in the U.S.? A lot of it has to do with propaganda from organizations like the New York Times. The New York Times predicted 2 million deaths in the United States if we didn't lock down. Sweden proved that the New York Times was completely wrong. The New York Times and many other propaganda organizations have been working hard to cover up the good results which occurred in Sweden. Sweden has a larger population than New York City, but New York City has had 10 times as many COVID deaths as Sweden. New York City has the highest death rate of anywhere in the world. The concept of a New York City newspaper trashing other countries is pretty astonishing. Sweden is doing extremely well. They've had very little trouble among the general population. Like many other countries in the world, the problems they have had have been with elderly care facilities. But unlike in New York, they didn't send sick people to nursing homes, which is one of the primary reasons why New York City has had the world's highest death count. The New York Times should be criticizing Governor Cuomo for his disastrously poor policies. The New York Times doesn't even recognize the fact that Sweden left their schools open. In this article they said, Danish elementary schools have become the first in Europe to reopen after shutting down for the coronavirus. This is incredibly deceptive considering that these Swedish schools never shut down. The New York Times is a propaganda organization, not a news organization. They predicted 2 million deaths in the United States. Their goal has always been to create fear. But let's get back to the topic of this video, which is reopening the U.S. schools. Here are the CDC guidelines for reopening U.S. schools. At first look, they all appear very sensible. But on closer examination, I see a huge problem with their guidelines. They say, is the school ready to protect children and employees at higher risk for severe illness? Right now, school children are being educated remotely or not at all. Low-risk children and staff should be in school, but high-risk people should remain remote. It's physically impossible to protect high-risk people in a school situation. High-risk people should be kept remote and they should not be a gating factor for reopening the schools. High-risk people are truly safer at home. There's been talk in a lot of states about waiting for a vaccine before the schools are going to reopen. Most experts have said that there's no reason to expect that a vaccine will occur anytime in the foreseeable future. But Dr. Fauci says finding a vaccine is definitely not a long shot. Fauci expressed optimism that a vaccine will be found for the coronavirus within a year or two. His confidence stemmed from the fact that most people can fight off the virus themselves, offering scientists an opportunity to devise a way to get the body to combat it better. So let's think about what Fauci said. He said that most people can fight off the virus themselves. In saying that, Fauci is confirming that the Swedish approach is correct. If most people can fight off the virus themselves, then herd immunity is the correct approach, and we don't need to wait for a vaccine. Our schools should reopen immediately, and we should start listening to scientists rather than propagandists like the New York Times. The Democratic governor of New Mexico, seen here wearing her blue mask, just announced that businesses can operate at 25% capacity. This rule, of course, doesn't apply to large businesses like Walmart and is a death sentence for small business. Very few small businesses can survive at 25% capacity, and they certainly can't hire back very many employees. She says that her approach is based on science, when in fact it's based on fear and propaganda. The only country which has taken a consistent and rational science-based approach has been Sweden, and they've also protected human rights and their economy as much as possible. Toto wants to see the kids back in school. Visit him on the web at realclimatescience.com. He's been pulling back the curtain on junk science and propaganda for a long time.